Okay, so I just returned from the clinic getting my bandages removed, and let's just jump right into the good stuff here. You want to see how swollen my head. I don't know why this right side of my face seems to be bigger than the other, but this is a really good lighting of them washing most of that off. Sorry that the housekeeping didn't come while I was gone this time. And this is what the back looks like now that the car, you can really tell how swollen it is from like looking at the sides. I got huge, big head things going on. I got big thoughts. Big thoughts the size of my head. But they did say that it was looking pretty good, but I did take the anti-swelling pills this morning, and I also took a tablet, a painkiller. I wasn't in pain, but I heard that the wash really stung when they removed the I don't know if that's a good angle or whatever. I have to angle the phone in certain lights in order to try to look halfway decent to where I'm pleased with myself. So it is what it is. I don't even know how I'm going to find a what do you call the photo that sits on your YouTube? Like the placement photo? There's no one here to answer that. But I can't filter through and look for one where there's hair because there isn't anything anymore. So this is just how it's looking. But I did take an anti-swelling pill. You're supposed to take 3. I guess I could go over what the pills are. So they give you painkillers, which I did take one before I went and had the back wash, just because I didn't want to feel like any extra pain. And so, and I took one yesterday too, because I could start to feel something going on. And it did leak all night. And that pad that they gave me was definitely useful, because when I woke up, there was like stuff on it. And so they gave me pain pills. They gave me antibiotics, blood thinners, and anti-swelling tablets. And then there's instructions on there on how often I'm supposed to take each pill. Normally, you get 2 nights stay with the hair transplant. But if you are here from my Bible study videos, then you know how I am about going to the dentist. And I never did get that tooth that I kept complaining about that was hurting me. Like once the pain stopped, that wisdom tooth, it is still in my mouth. So, but anyhow, I don't go to do normal dental checkups semi-annually. I go annually because every time in the past when I went every 6 months, they would never do anything. And so I got into the habit of going once a year. But lately, like the year before last, I went like it was at the 14-month mark. And I don't know why I started slacking with going to the dentist once a year, because it's not like a huge budget thing once you take care of your teeth. Because I go to different dentists because I don't have dentist loyalty at all. When you go to a new dentist, all of just for the cleaning, the x-rays, everything is usually it's like at $60 for new patients, and sometimes it's like $80. So I have been to the dentist. I passed through Georgia once and went to the dentist on my way back from Florida. I was like, oh, I'm just gonna stop in Georgia. Like if anything happens to me, they have dental records for me in Florida, California, New Jersey. So I am not kidding. Atlanta, St. Louis, Memphis, Tennessee. They'll have the killer before he can get away. They're going to be like, this is it. We've identified the body. Let's get the killer. I don't know. Anyways, I don't have dentist loyalty. I go to a new dentist just to get the deal, because it's cheaper to go to someone new because they welcome new patients with that package. But this time when I went to the dentist, they said that I waited too long. It was 15 months. It was at the 15-month mark. So now I know I really do have to keep it at 12 months. Like literally, I can't go over a year. And so he said that I needed like a light scaling, and then they were going to try to charge me $250 per quadrant. But what was crazy was that I actually have dental insurance now through this SAG after my union, acting union, and so I couldn't understand why I had to pay so much out of pocket. I was like, see, that's why I'm not loyal to dentists, because it costs so much. But because I was coming here for the transplant, they have cheap dental work in Turkey too. So I was like, how much is the scaling in Turkey? It was like $75, but then when they convert the lira over to the USD, ended up being like 89 or like $90. Just say $100 for the same procedure. So I just asked the dental receptionist to email me a copy of my x-rays, and I sent it over, and then they're going to scale my teeth. So I extended my stay for 1 day so that I can get the scaling, but I did that beforehand, but I just never mentioned that, that's something I was going to do. So if you are looking for new hair and new teeth, Turkey is the place to be. I'm not getting teeth, but I am getting that scale and polish done later on today. Let me see what else. I've decided to go through with I spoke with the doctor today, and she just was, I told her about my interest. I was just like, yeah, I want it all back. So yeah, I want to go through with the second one. And then, they just instructed me to take pictures like, on the 3rd month and the 6th month, send them over. I was trying to schedule it to be around like March 15th of next year of 2027. And so and not to, relax my hair or whatever, because, she wants me to like take collagen, continue with my biotin, so that I can get more, like each hair follicle has like 3 or 4 hairs in it. But when she went through mine, because my hair is so fine, she said there were a lot of 1 hair. And so she wanted me to, start on collagen and stuff and see if, they can harvest more the next time. And, but I still have to wait a year to get the crown done. So I am definitely going to go through. I already talked to them about it, and so it is in the works that I'm going to come back and get that done. That's pretty much it. If they do anything special at the dental office, I'll add another video on here. But if not, I'm trying to think, should I add my dental experience? Yeah, I might as well. So I guess I'll just add my dental experience and any extra that I want to say later. So that's it. Okay, so I just returned back from the dental office that Longevita uses, and I was able to get a scale and polish. They just went in and got like extra buildup off my teeth. I didn't have to have any, numbing or anything. And then that was it. It was like super fast and super cheap. So I definitely recommend that option too. There were other people there getting like the Hollywood smile. It was one, she was American. They said they were like prescribing her medicine because her mouth was open for 3 hours. But I don't know what procedure she ended up getting, but I do know that they have really cheap dental work. So I would definitely recommend the dental work as well. Okay, so my do's and don'ts. That's what I want to go through. Okay, do take a couple of hand towels with you. They are extremely helpful. Although you can't use them during the surgery, you can use them afterwards. Especially when I went in to get the shampoo today, they put this like foam. They put the foam on and it sits there, and then they give you 2 little small paper towels, and you're sitting there dabbing, which is what I saw other people doing, while I had my trusty hand towel available. And then also I had it to put around my neck for that extra dripping that might be happening from the donor area in the back. Do use lidocaine. It is going to save you much pain. Do take a pain pill that they give you after your procedure the next morning before they pull the back part off and do the wash of your donor area. It wasn't so bad for me today. And you don't need a visa. I kept hearing people say you needed a visa to come to Turkey when I was watching some of the journeys. And I don't know if it's because they came from different countries, but if you are coming from the USA, you just need a passport in order to get into Turkey. I highly recommend Longevita. I am coming back for a second hair transplant to do my crown area. And so I'll post here at the same increments that I have to upload to Longevity, because I know I'll remember to upload to them. So I'll come on this channel and then I'll upload at 3 months, at 6 months, 9, until I go back. I'll do that 3-month increments, posting on here. In the meantime, if you want to see like any progress, I'm not sure when I'll start posting on my Bible study channel, because it's so hard for me to find I guess maybe after this, I don't know, but maybe I'll start showing my hair on there. And if you're wanting to see, then you can come to my Bible study channel, and that is at Latricia, Latrisha, on YouTube, and check out my results there, and also dive into scripture with me, and or just read along with me to know what's in there. A lot of people have a high opinion about the Bible, but they've never read it, and so I don't want that to be you. And I'm leaving here to head back to the States tomorrow. That is it for this series. I'm gonna stop it, and if I think of anything else in the next 5 minutes, I'm gonna post it. Okay, so I have my couple of don'ts. Don't wear a turtleneck, because they are not going to let you have anything that is not sanitized up, to where it could possibly touch anything that they are doing. But do wear a stretchy shirt where you can pull it over your head with ease, and I think that a lot of the stories and the journeys that I was watching were from a couple of years ago, and they probably have gotten better because they put like a covering over my eyes, so when they did spray, like nothing ran down my neck. I wasn't wet. I didn't need that towel for that. The towel did come in handy though for drainage, and the following day they do put that foam on you, and then they only give you a couple of towels, and if you have your towel there, you can catch that and it won't run down, because I definitely wore my makeup to the clinic today because I can't with this, and my head is getting larger by the moment. And then also do, if you can, don't check your bag at the airport. If possible, just bring a carry-on, and if possible, just bring a carry-on duffel bag, because all of the carry-ons never fit in those tiny, where they try to get you to put it in the tester. That they don't even make suitcases that small. I don't know, but I know that the carry-on that I have will not fit into one of those, and they would just ultimately ask you to check your bag anyways. So if you're coming a long journey, just get a duffel bag. The duffel bag doesn't have to fit in those. They don't even ask you, because it's adjustable in size versus a hard suitcase. And then that way you don't have to check your luggage. And if anything happens, you'll have everything that you need right there with you. And that's it, guys. Thank you for if I hope this helped anybody who may have hereditary alopecia, and they're considering getting a hair transplant. And then just stay tuned for it within the next year to watch my results, because I will be posting every 3 months. So this is February, so March, April, May, the end of May, beginning of June, I'll post, and so on and so forth. And I'm definitely posting in September, because that's my 6 months. Well, it's the beginning of September, so yeah, I'll have a ponytail. And then after the year, I'll have enough hair everywhere to wear like a low cut for just a moment before they shave the back off. But my mom, when I was little, she used to wear this. She used to wear her hair in the front, and it would be pulled back, and she had like a a clip-on piece that she would put here, and then I guess it was something cute or cool back then to wear. She would have like a fishnet over the the piece in the back. I'm probably not gonna get a fishnet, but I can probably do something like that to wear my hair in the front and then put like a clip-on piece in the back for that. And then and I won't need a full year after that for that to grow back in once I get the center done, because when it just starts coming in curly, you can wear the back curly and then like the front long, and make the most out of having the back shorter and the front longer during those time frames. So it's just going to work out, I think, all for the good. Thank you, Jesus. So thank you for watching, and have a good day. Bye.